No, listen, we don't have to understand. We can understand 1% of the brain. We understand less than one. I mean, I'm a fan of Neil deGrasse Tyson, and he and Michio Kaku, they often kind of remind their listeners, and I think appropriately, and I appreciate this, they remind us the scale of the universe and how little we know.
Yeah.
I forget which one says that for all of what we know and for how powerful we are, we can't even do or understand what one cell of a blade of grass can do, which is photosynthesis. We don't understand how that works. But that doesn't mean you throw out
I think what
everything
what it
else.
says is at least speaks to humility.
Of course.
Right.
Naturally. But we work with what we have. I mean, it doesn't mean we just stop and we don't do anything.
But we have more. And when you're in the bubble and you're reduced to the material paradigm and you're in a profession that has aligned itself with the pharmaceutical industry, that's why I said you take away these drugs and the role of the psychiatrist in the greater healthcare system disappears. You'd have to reinvent yourself. So there's such an inherent conflict that exists. You have to defend the drugs because you're prescribing them, because you're studying them, you're researching them, you're communicating it from that paradigm. You're the only psychiatrists that have these conversations with me are the ones that said, "Yeah, I know," and I left. And there's lots of them, you know. And I do believe. I mean, part of this is a profound disappointment because I think we need medically trained physicians in the mental health realm because I think there's so much we can be doing with lifestyle. There's so much with like, innovative research around like light and metabolic health and nutrition. There's sleep. Like there's so many aspects of this.
All that research is being done.
I know, but it's not what's being provided as the standard of care in our country. And I bring in those physicians to have those conversations. But how we practice is Stone Ages. I mean, we're still pushing pharmaceutical drugs. And if you meet you never meet a psychiatrist who thinks the same way around these drugs. Like I'll get like 10 different patients. They're all given the same diagnosis. They're all treated with so many different drugs over, 10 years. They're all horrible. Like they're doing really, really bad. But somehow they've been brainwashed to think, well, I've got this illness for life and I just have to keep taking these drugs. And so I do think we're inducing chronic mental health conditions by the way that we're treating them. And at some point, in our communities that there'll be teenagers or young adults where a doctor will say, lay out a couple drugs and say, pick one. Like that's how bad that it's gotten. And nurse practitioners.
I don't know about that, but listen, I mean, I can't comment. I've not heard of that. Maybe it happens. I mean, listen, I don't know what to say about that, but what's happening in psychiatry, you might not agree, might not disagree with this. The state of research and whatnot in psychiatry is not much different than in other fields of medicine.
Oh, it's much different.
No, it's very similar. I mean, we did.
How can you say that? How can you say that when it's subjective and you can actually make statements here that we have a biological basis for this, but how much money has the NIH dumped into trying to identify mental illness as a brain condition? So much so that they've abandoned it?
Not sure they've abandoned it.
The dollars
research on. I'm funded to examine the pathophysiology, like neurobiology of psychiatry. I'm not sure. What do you mean abandoned it? I'm not sure.
Well, the dollars aren't there in the way that it used to be. Now there's certainly money that's being invested in various aspects of physiology and biology and mood and elsewhere, but like as far as like that decade of the brain and the amount of money that we devoted 90s into like 2015, that paradigm is really we've kind of moved away from it because it just hasn't produced results. It hasn't done anything to move the needle. In fact, if anything, in my opinion, obviously it's much, much worse, but it certainly hasn't reduced the burden of even severe mental illness in this country.
Oh, sure it has.
Oh my God, Doc.
No, there's no doubt about that.
Doc, you think we've reduced the burden of mental illness in the United States?
Severe mental illness. So I would look at mental illness, this is what I was talking about. I would look at mental illness the kind of way we look at cancer. So rates of cancer are increasing.
That's a problematic comparison.
No, it's, I mean, what do you, well, anyway, the rates of cancer
because
are
we're not
increasing.
really good at treating cancer either.
But, so this is so the analogy is actually, I think, pretty strong. So the rates of cancer are increasing. So the question is, why? Have we failed? Are our treatments for cancer just no good? Do they not work? They do work, and we have more treatments than we've ever had, and some of them are amazing. But cancer rates are rising. But we have to understand really why they're rising. They're rising for maybe 2 or 3 main reasons. 3, I think. And this is actually maps very well onto mental health. Number 1, earlier identification. Number 2, people are living longer overall. I know in the past couple of years there's changed, but overall people are living longer. So you're older,
But people are
you have a
getting
risk
people are
of cancer.
getting cancer younger now than at any other point.
And maybe 4, and increase of rates of obesity, which is strongly linked, to cancer, of course, and then increased substance use. So those 4 things. Psychiatry is not much different. So, but we're able to treat cancer much better. Psychiatry is similar. We're able to treat more severe mental illness better. Remember, rates of chronic hospitalization have gone down. So severe mental illness, they've gone down, while rates of mental illness have gone up. We can treat the most severe forms. We disagree about the data, but for example, suicidality and stuff like that. And again, we can keep people out of hospitals. So the severe mental illness or severe kind of forms is similar to cancer. That's what I'm saying. They're very similar. And again, people do. I can't go through every study. I don't know every study, but if we compare mental health in general or depression and psychosis to diabetes, you have type 1 diabetes, which is very different than type 2 diabetes. Type 1 diabetes is purely genetic. It's just, that's it. Type 2 diabetes is mostly, it has a familial component, but it's very environmental and social, right? Maybe to a larger degree than depression and psychosis, for example. There's a much stronger biologic component. There's a psychosocial component, there definitely is, but it's smaller than, for example, the environmental component to type 2 diabetes, which is almost exclusively related to overweight and obesity and those sorts of things. So, we do the best that we can. We have research methods. We have bias and limitations in what we do. We try to address it. We do the best we can.
Well, I want to give you credit. You are the first person who actually stated that we're actually doing a good job and we're reducing the burden of mental illness in this country. You're the first person I ever heard that.